What does the term vertigo mean? Is it the name of a disease?
Vertigo is not a disease by itself. Vertigo, very much like pain or fever or cough, is the manifestation or outer symptom of some underlying disorder. The doctor's duty is to find out what is the underlying disease that is causing the vertigo. The word vertigo, in colloquial terms, is an umbrella term used to signify anything related to head spinning. Head spinning, instability, sinking sensation, dizzy feeling, everything when the patient comes conveys that sensation by using the word vertigo. It can be of two types. It can be internal vertigo, where the surroundings appear stable, look stable, but the subject feels that internally inside the head there is a spinning going on. So that is very important. That is called internal vertigo. Or it can be an external vertigo. In external vertigo, the patient does not feel any spinning inside the head. The patient sees that the surroundings, the visual surroundings are all moving. So that is called external vertigo. If there is no movement, either internally or externally, then it is not vertigo. It is something else. It can be dizziness, it can be a lightheadedness, it can be something like unsteadiness. So these are completely different.
How is vertigo different from dizziness, unsteadiness, lightheadedness, or blackouts?
Unsteadiness, dizziness, lightheadedness cannot be mixed up with vertigo. So this is something which all patients have to understand such that they can communicate their feelings properly to the doctor. So another sensation that the patient gets is the feeling of lightheadedness or blackouts or a sinking sensation. This is completely different. In sinking sensation, the patient will feel that the patient is about to faint and as if the patient has lost control on the limbs, and if the patient does not lie down or if the patient does not sit, the patient will faint and fall down. These sensations are usually accompanied by a blurring of vision or a blackout, something like that. So, this is completely different. This does not have anything to do with the balance system. And that is precisely why the different professional bodies related to balance disorders have come out with specific definitions of each of these different feelings: vertigo, lightheadedness, dizziness, unsteadiness, etc. So it is the patient's duty to communicate the exact feeling to the doctor.
What is the cause of vertigo?
Vertigo, or let us not use the term vertigo, let us call it balance disorders, because vertigo has a meaning, as we have already said. If you call balance disorders, that includes everything. So let's use the word balance disorders. The causes of balance disorders may be numerous. Balance disorders can be due to diseases in the ear, they can be due to diseases in the brain, like in the highest levels of the brain, the sensation of vertigo is generated. So if there is any defect in the cerebral cortex or in the highest echelons of the central nervous system, the patient can get vertigo in spite of having no other defect in the ears or in the neurological system. So, vertigo or rather balance disorders can be due to disease in the ears, it can be due to disease in the brain, it can be diseases in the peripheral nervous system. If the nerves of your legs become weak, then also you can get a sensation of instability. It can be due to diseases in the cardiovascular system. So there are numerous reasons why you can get vertigo. And as I said, the ears, there will be at least 50 diseases of the ears that can cause vertigo. There can be at least 50 diseases in the brain that can present with vertigo. There can be at least 10 diseases of the heart, like arrhythmias, and other things, where the patient can come to the doctor complaining of vertigo. So you see, the physician has to be extremely alert and analyze the patient's symptoms properly. And if a proper history is taken, it is not difficult to find out where the vertigo is originating from.
Is vertigo a life threatening disorder?
Both yes and no. Usually, no. Vertigo is usually not a life threatening condition. In many cases, it is even self limiting. But in rare cases, it can be due to some life threatening condition like a tumor in the brain, or worse still, it can be due to a cerebrovascular accident, that is, a stroke in the brain. A stroke or a cerebrovascular accident in the backside of the brain can make the patient present to the doctor with acute head spinning. And if the doctor misses this particular condition, then the doctor will lose the patient. The patient will die. So it is extremely important that any patient getting vertigo seeks medical help immediately.
Vertigo is the symptom or manifestation of some underlying disease. How is the underlying disease that is causing the symptom of vertigo diagnosed?
Underlying disease that is causing the symptom of vertigo is diagnosed primarily by taking a very, very thorough, detailed history. The diagnosis of vertigo is dependent 90% on a very accurate history. Patient needs to explain to the doctor the nature of the symptoms, and then on the basis of it, the diagnosis is made. Of course, there are some investigations, there are some clinical tests that the doctor needs to do, and of course, certain investigations that includes the sophisticated vestibular function tests or some imaging studies like an MRI of the brain. All these things are also required. But if the history has been very properly taken, a diagnosis is possible in more than 75 to 80% of the cases. If the clinical tests that the doctor carries out in the clinic is done properly, then more than 90% of the cases can be diagnosed. Only in a few cases, we need these sophisticated investigations. But that, of course, does not mean that we will not do the investigations. Investigations are also necessary because the doctor needs to be sure that he is not missing out on something. But for basic purposes, if the history is properly taken and the doctor has spent enough time with the patient, if the clinical tests have been done properly, then a perfect diagnosis is possible in most cases.
What is the most important tool for diagnosing the underlying disease that is causing the vertigo?
Yes, of all the different modalities that are used for diagnosis of vertigo, like history taking, clinical tests, some investigations like the vestibular function tests, and brain imaging, that means CT scans and MRI, the most important thing, diagnostic tool, is a very thorough history taking. Nothing can beat it. If from the history taking the doctor suspects that there could be something wrong in the brain, then of course the MRI becomes very, very important. The vestibular function tests have got limited role, though they are hyped up very much. They are not that useful, and they are only useful if the clinician who is treating the patient has got a deep insight into the testing system and can interpret it very well, which is not very common. So that is a problem or hindrance of the vestibular function tests.
How is the underlying disease causing vertigo treated?
Yes, it is the underlying disease that has to be treated, not the symptom of vertigo. If the underlying disease is treated, then the vertigo symptom will come down by itself. So, this is the most important thing, finding out the underlying disease and treating it. So, this is a very, very relevant question. There are basically four modalities of treatment. One is medicines, which is called pharmacotherapy. Second is physiotherapy, which is called vestibular physiotherapy. Third is psychotherapy, that means counseling, etc. And fourth, rarely, which is required, is surgery. So these are the basically four modalities of treatment.
In between medicines, exercises, psychotherapy, and surgery, which is the most effective treatment for vertigo?
The most effective of all these four modalities that we discussed is nothing but vestibular physiotherapy. They are the best thing or the most effective tool for treatment of balance disorders. Because once the vestibular system has been damaged, restoration of balance is possible only and wholly and solely by vestibular physiotherapy. That means exercises. So it is the exercises that is the most important thing. But the other thing, there are two other modalities. One is psychotherapy. A lot of balance disorder patients require sophisticated psychotherapy and therapies like cognitive behavioral therapy, etc. counseling, reassurance. That is a very important part of the treatment. Partly that has to be done by the doctor himself, and sophisticated things like cognitive behavioral therapy has to be done by a professional psychologist who is trained in counseling and treating balance disorder patients. And lastly, in a very few patients, we require surgery also. Rarely.
How relevant is the role of medicines in balance disorders?
Medicines do have a role in the treatment of balance disorders. Now, medicines can be of two types. One is the symptom relieving medicines. It is just like giving paracetamol in a patient of malaria. So that is symptom relieving, which will reduce the fever. So it is something like that. So there are medicines which are called symptom relieving drugs or anti-vertigo drugs or vestibular suppressants. So these medicines can be used for a very short period because their job is basically to give some symptomatic relief to the patient, but they do not cure the underlying disease which is causing the vertigo. So the second group of medicines are the primary medicines because they are the medicines that actually treat the underlying disorder, and these medicines will depend upon what is the disease. Like if the patient is having something like Meniere's disease, then it is treated by, say, diuretics. If the patient is having something like vestibular neuritis, it is treated by steroids. If the patient's balance disorder is due to some psychological problems, it is treated by psychotropic drugs. If it is due to migraine, it is treated by migraine related drugs. So you see, that is how the medicines are selected.
Are balance disorders curable, controllable in all cases?
Yes, curable in most cases, but in certain cases, even if it is not curable, it is highly controllable. So, if treatment is proper, if the underlying disease has been properly diagnosed, the patient is bound to get relief from the balance disorder for which the patient had come to the doctor.